Hey everyone, we are getting ready to start day number 2. This is second shift of our 7 days of NCLEX. Come on in right now. It's a game day. So you will be using not one, but 2 devices on today. You're going to be watching the questions on one device, and then you're going to be playing the questions on another device. So have the capacity to do so. Go to your second device, pull it out, go to kahoot.it, and you're going to enter in today's game pin. I see we have Shanti from AZ, Kathy RN. Your game pin is 582-1131. 582-1131. Come on in. We're going to be getting started for second shift. And we also are going to be continuing to fill out our workbooks too. So I'll do some housekeeping things. The game pen will always be scrolling down at the bottom, so you can't miss it. Just tap in, hold tight as we prepare for day 2 of the second shift. I see you, Kat. I see you, Paul. Let me know where you're from too in the comments. I know I had a global community. Good afternoon, everyone. Someone says, "Oh, I'm coming in. Please, I have to work. I'm at work now." That's all right. That is okay. You're learning. Still. 500 people watching. This is phenomenal. All right. Okay. We are Cleveland in the house. I got somebody from the land here. Also Michigan, Georgia. Good evening, good day, wherever you are. No. So if you don't have your workbook, we are doing pages from the workbook today, actually. We are doing pages from the workbook today. But as you are coming in, I have a very special message from our favorite nurse on today. You guys know who she is. Put her name in the comment when you see her. Got a special message, and just say hello. Say good afternoon.
I see you back again, Remar nurses. You left your books at the nurses station. These belong to you, don't they? I had a good old time on my lunch break looking at what you've been doing, how you've been studying for NCLEX. I wish I had this when I took my NCLEX. You know, I took it paper and pencil. But I see you got your videos right here. This is where you watch the lecture content. She got all the content that you need to pass your NCLEX. All types of subjects in here. Stuff you need to know. I loved it. I love watching it. And then I see you got your book. You took your notes in it. You can't leave this around because your notes is in here. You took some good notes in here. And I see you all get this all done in about 30 days. You be ready. Oh, and this one right here, this is the book right here, the quick facts you call it. This is your favorite book, ain't it? Yes, and you put them all together, you be ready to take your NCLEX, but you gotta do each one. Don't just do the lectures and not do the quick facts. You gotta do both. And then I see here there's a question bank right in here on your phone. I took a cat test. And I was looking for the dog test. I didn't see the dog test. I just took the cat one. Maybe I'll take the dog one later. but it was a good time studying and getting ready for your NCLEX. So I want you to finish your program so you get your nursing license and be a nurse, a RN, or you be a PN, whichever one. I need them both here in the hospital. And I believe you can do it, but you got to do the program. You can't leave your books around. Somebody steal them. I'll keep them for you till you're ready to come back and study. But I heard the V2 on sale. I went to the website, remarnurse.com. V2 on sale right now. So I might keep these ones. You go get you another one. Miss Henrietta won't be ready with all this new knowledge, new technology. I'm going to take all the cat tests I can take just in case I end up taking care of a cat one day. I don't know. But I know you're going to pass this NCLEX. You can, you will, and you must pass NCLEX. With God, it's possible, baby. It's possible.
Thank you so much, Nurse Henrietta, coming through, always giving us that very great information that we need. We're going to be good nurses like Nurse Henrietta one day. I could just feel it right now. We're getting ready for second shift in the house. If this is your first time joining, hi, my name is Professor Regina. We are in the middle of 7 days of NCLEX. We had our first shift last night. We're doing a game day plus substance abuse today. We're filling out our workbooks. This is what we will be working out of for 7 days. If you don't have it, it's not too late. Go to remarnurse.com/7 days to download your workbook. And after the 7 days, guess what? I want you to continue on with this great information in my V2 program. Everybody who gets the V2 during 7 days of NCLEX will also be gifted my bonus book, First Shift. So 1 month access right now, $69. 3 months access, $99 plus First Shift. We will be also going inside of the V2 platform, and we will be looking at your content today too. So the 7 days of NCLEX is to jumpstart you to getting into the V2 program where the video lectures are going to help you. All right. So people say, you have the workbook, you're ready to go. This is amazing. We have so many good things. I didn't even get a chance to talk about the travel nurse jobs that we have. We will be diving more into that for those of you who are looking to do those assignments with Remar, with Safe Nurse Now. So just a many good things. Substance abuse, that is right. And we are getting ready to jump into our Kahoot game pen, as well as we are talking about the V2, how to pass your NCLEX, all that good stuff. So tap in if you are ready to play Kahoot. All right. Yes. Good morning. I was on TikTok late last night. I was on TikTok to almost 1 a.m., 2 a.m. last night. We had a good time there too. Okay. So if you're playing Kahoot, you guys know, go to kahoot.it. The game pin is 5821131. I got almost 300 people playing for Kahoot. Money is the name of the game. Wow. Money is the name of the game today. Cash prizes for you. I'm going to give you 10 more seconds to hurry up and get into Kahoot. I'm going to start this game. If you want to jump in later or just answer in the comments, that's okay too. Help your fellow nurses out with your knowledge before we get into our formal lecture. All right. So 10, 9, 8. Are you ready? 7, 6, 5. Hurry up. Go to kahoot.it. All right. Put in 5821131. That's how you join Kahoot. People are like, hold up. It's so easy to do. Listen, in order for you to play this game, real quick, because a lot of people already know it, you need your cell phone. You need to be watching me on your laptop or your TV, and then get your cell phone and go to kahoot.it. Go to kahoot.it in your browser, Safari, Chrome, and then put in the game pin. Okay, that's how you're going to do this. All right. I know some people joining. So get that cell phone, go to kahoot.it, 5821131. We there? All right. Let me know if you guys can hear me. You're good. We're good. All right. If you can hear me, say I'm ready. You can hear me, say I'm ready. All right. I never, okay. So you guys can hear me? We good? Cause I'm gonna be reading these questions. Okay, you guys can hear me. Okay. Let's go. Somebody gonna win? Oh, you're right. We're not gonna have no issues today. Heavenly Father, we just thank you for a new day. We thank you for the opportunity to study. We thank you for the opportunity to be together under one accord. And we give you all the glory, all the honor. Let your will be done in this study session. In Jesus' name, amen. All right. Now we're good. Bueno. Let's go, y'all. We're going to start this game right. In 3. Where's my countdown at? Second shift. 3, 2, 1. First question is this. Which diagnostic test should the nurse expect for a client taking 80 milligrams of aspirin daily? A blood glucose for red, yellow is chest x-ray, blue is stool guaiac, and green is lipid panel. Which diagnostic test are we expecting here? Let's go, Remar nurses. Let's go get these answers in. They're coming in so fast. My goodness. You're understanding pharmacology here. You're demonstrating your competence. I cannot believe 800 people show up at noon on a Friday for the second day of, oh my goodness, of 7 days of NCLEX. Who's 2 for 2? Grace is here. Ashley's here. 10 seconds. Put those comments on. Let's see who came out first and fast. First and fast and right. Those are the things that we need. Ooh, most of us got it right here. Whew, that's so close. I did put some distractors in there. Beatra, I see you. PD Ward and Coco. Lexi, these are our top 4 right now. It's not too late to join. You guys know aspirin has a risk of GI bleeding. Well, we want to see if there's any bleeding in the stool. All right. Here's double points. What medication instructions should be included for a post-transplant patient taking a statin medication? Red, take it on an empty stomach. Yellow, do not take with grapefruit juice. Blue, gum bleeding is normal, usually goes away. Or green, in case of missed doses, double the dosage. Some pharmacology here. What do you know about statin medications? Statin medications are used to lower cholesterol. So we expect this to be on NCLEX because how many people have to take statin medications? And when you take a statin medication, usually when you start taking them, you take them for the rest of your life. So the teaching is really important. PNs and RNs are able to answer this question. Every question on here, both RNs and PNs can play. So what is our concern? Is it red, yellow, blue, or green here? I see some yellows. I see some blues. Correct answer, majority of us got it right, is absolutely yellow. For some reason, grapefruit juice is a huge offender of medication. So we don't combine statin medications with grapefruit juice. Great job. I'm moving on. My leadership board changed. When positioning a rectal suppository medication, how should the nurse position the patient? When administering it, how should the nurse position the patient? Red, Trendelenburg. Yellow, semifallers. Blue, left sims. Or green, prone. If you're going to give a rectal suppository medication, come on, put this in quickly. What is our position for the patient? I'm seeing lots of yellows at first. Now I see a red. Now I'm seeing some blues. I have Facebook playing. I have YouTube playing. And I'm really wondering who's going to have the more of the right answers. My Facebook audience or my YouTube audience? Very different groups. Okay, most of YouTube is saying blue. Most of Facebook is saying blue as well. 5 seconds left. Over 375 people Woo, over 300 people chose blue. Good job. Okay, safety, Lexi, I see you at the top. Jael, did I say that right? Welcome to the leadership board. We're going to place our patient in the left Sims position or lateral. Here's double points. What about this one? Which of the following is a common side effect of tetracycline? Red, constant diarrhea. Yellow, fever. Blue, teeth discoloration. Or green, swollen face. We have just started our shift. It's not too late. Share this video. Share this game. Your nursing student, friend, maybe they don't know that this is happening right now and they're just scrolling Facebook. They could be learning. They could be educating themselves. We're talking about a very serious antibiotic, tetracycline. You should have a flashcard for tetracycline with the information in it about tetracycline. All right. If you don't have quick facts for NCLEX, then you need to make a flashcard right now for this medication. Right? Smash that share button, smash that like button. This is the largest and best community event happening right now. Woo! Teeth discoloration. I only was able to trick a few people with red. Sorry, welcome to the top. I'm moving on. Teeth discoloration. Yes, in tetracycline, especially in children. It can turn those teeth brown. Wow. What food classification should a client taking isoniazid avoid? Is it red, foods high in iron, yellow, foods high in tyramine, blue, foods high in protein, or green, foods high in omega-3? Ooh. Got to be so careful here. Actually, you know, when I see the comments, sometimes you guys confuse me. I'm like, wait a minute, is it this one or is it this one? Because so many people are going with this one. I'm like, which one is it? All right. There's only one answer here that is the best answer. What's it gonna be? What's it gonna be? All right. Pow. 8 seconds on the board. Cash prizes today, $100, $75, and $50. You cannot lose if you're top 3. Good job. Foods high in tyramine. The majority of us got this one right. Leadership board is moving. I wonder who will be at the top. Tyramine can act with isoniazid, may cause palpitations, flushing, and hypertension in clients. Tyramine, if you see it as an answer choice on NCLEX, you might want to consider picking it. Which medication is best to treat a panic attack? Is it a benzodiazepine, a parasympathetic blocker, an opioid, or an amphetamine? Ooh. What about a panic attack that is going to have you, all right, that is going to have you running, all right? What are we going to use to decrease anxiety, all right? I've been working on my mental health lectures for the nursing school V2, and I am absolutely loving the medications that I get to review again for psych. Right? Got to know about panic attack, got to know about addiction disorders, got to know about anger management if you're in nursing school. These are very important mental health considerations. And right now I'm looking for that right answer. 4 seconds left. Yay, Remar nurses knew it was a benzo. Let's go. Who's ready for their first job? I feel like you guys are prepped and ready to start orientation somewhere. What nursing consideration should be implemented when administering albuterol to a client? Red, administer 60 minutes before exercise. Yellow, wait 1 minute between inhaling puffs. Blue, monitor symptoms of hypoglycemia. Or green, contraindicated to clients with hypotension. So there are many answers, but only one is right here, just like NCLEX. What nursing consideration should be implemented? implemented. Talking about albuterol. Think about the function of albuterol. How do we typically use it? 15 seconds, get your answers in. I should have 1,000 comments by now on this video because we have over 900 people answering this one question. So I want to see thousands of comments. Yes, we have to pause. We have to pause between inhaling this medication. Great job, Remar nurses. Tapping in this holiday season. You have not given up. Which vitamin is used to treat hypocalcemia? Is it vitamin E? Is it vitamin B6? Is it vitamin A? Or is it vitamin D? Okay. Listen, don't pay attention to the slides because the slides and the questions are so different in Kahoot. If you're taking the exit HESI, my advice is for you to just do the NCLEX prep. Okay. Just do the NCLEX prep because the exit exam is going to be very close to NCLEX style questions. So if you do the content review, you will do well. I had a PN student that did the NCLEX PN review. She was the only one in her class who passed the exit exam. Yes, that's what I'm talking about. She prepared herself, did the work, got the results. All right. So position yourself for success. Just take the review course. All right. 8 seconds left. I'm asking about hypoglycemia and hypocalcemia and the vitamin. You got it. Yeah, it was vitamin D. Who got that first? Lex got it first. I see you. Coco is up there too. Let's mix it up a bit. Quiz time. What type of insulin can be administered intravenously? Is it aspart? Red? Is it yellow? Lispro? Is it blue? Regular? Or is it green? Gluglycine? Giving insulin IV is a real thing. Patients can have blood sugars 800, 900, especially if you're working in the MICU. If you're going to be working in the intensive care unit, you will see these blood glucose levels that are really high. And the doctor is going to order you to give blank insulin IV. Which one is it? Safe Nurse Now. Safe Nurse Now. Reveal yourselves by answering these questions correctly. Yeah. And this is the stuff you may have missed in nursing school. You may have missed these points in nursing school. So that's why I say show up to class here so you can learn. Yes. 300. Yes. This makes me so happy. But there are 30, 60. There are almost 80 people who did not have this answer right. So I want to pause so that you can remember this because this is a huge safety point, okay? This is a huge safety point. The only insulin that can be given IV is what? Come on, guys. Is regular. We want to be safe nurses. This is double points. What about this? What factor is associated with developing when you're taking metformin? Okay. Is it unwanted pregnancy? Is it lactic acidosis? Is it acne or is it concussion? All right. Here we go. We're talking about metformin. Are we worried about unwanted pregnancy? My. Lactic acidosis? Are we worried about acne or concussions? Oh, come on now. As part of our training is being able to answer without second guessing ourselves. So the reason why I do Kahoot is because you may struggle with choosing an answer and then being like, no, I'm going to change it. Kahoot forces you to choose one answer first, and that's it. The Kahoot game pin is 582-1131. There we go. Metformin and lactic acidosis. Safety point for your exam. Okay. You're going to be happy with seeing this. If you see this on NCLEX, you're going to be like, yes. Double points. For a patient taking atropine, which activity is recommended to avoid? Is it red, increase fluid intake? Yellow, taking extra hot showers? Blue, high in fiber foods? Or green, exposure to cold? All right. For a patient taking atropine, which activity is recommended to avoid? I mean, we don't want the patient to do it. We will advise them not to do these things. Okay. And kind of talking through this with yourself on the day of the exam. Don't talk too loud because you don't want them to flag you. But you do want to be able to see if something makes sense. Visualize your patient doing it. You got it. You got it. You got it. Hey. All right. And taking extra hot showers. Because if you think about the type of medication that atropine is, you will absolutely think about how heat, how hot tubs, how all those things put your patient at risk. Okay. Which nursing intervention is inappropriate when administering potassium chloride to a patient? All right. Red says keeping the client upright when given oral medications. Yellow, tell the client to swallow the whole medication. Blue, liquid forms should be diluted first. Or green, infuse IV potassium with a slow, direct push. Okay, so I'm reading them to you. We're talking about what's inappropriate. Keep the client upright when giving oral medications. Tell the client to swallow the whole medication. Liquid form should be diluted first, or infuse IV potassium with a slow, direct push. Oh, what are we going to do here? Good job, everybody. Everybody got that one in so fast, we didn't even have to wait for the full time. And that's what I love. Once everything is answered, it will just show the answer. All right. Never give IV potassium, slow, direct push. I've been on this for a long time. I want everybody to see it, right? Which herbal medication is used to lower blood pressure? Is it red ginger, yellow garlic, blue ginkgo biloba, or green grease fine leaf? Okay. Which herbal medication is used to lower blood pressure? Is it the ginger, the garlic, the ginkgo biloba, or the grease fine leaf? We are sticking to our goals. This is our holiday cheer. That nursing license is so close. We can taste it. I know you're looking at jobs. I know you're calculating how much does an LPN make in my city? How much does a night shift LPN make in my city? I know you're doing it. How much is an RN? How many shifts do I have to work to get the new furniture? All that stuff. I know you're doing it. You're so close. You're so close. All right. Herbal medication. Garlic. That's the one. All right. Good job, Martin. You bumped yourself up there. Come on. Garlic is used to lower blood pressure. All right. Now, quiz time. Here we go. Double points. Which of the following laboratory values determine a client's nutritional status? Is it the electrolyte panel? The creatinine, that's yellow. Blue says the serum level, or green says albumin. So here we're connecting a client's nutritional status. Are we looking at the red electrolyte panel, the calcium, magnesium, sodium, potassium? Are we looking at creatinine? Okay. Are we looking at the serum level? Or are we looking at the albumin? I'm waiting on you. Because I know you have this. I know you can do this. Okay. Talking about the nutritional status of our patient. And I got 10 seconds to see where my safe nurse is at. Where you at? Where you at? Because you will definitely have this knowledge as a safe nurse. Boom, there you are. Albumin. Now, I know the electrolyte panel looked good, but it is not the best indicator of what we're talking about here. We're talking about nutrition. So I'm looking at, I need to know my patient's protein. I need to know my patients. What are they doing? All right. Protein. Or are they at risk for malnutrition? All right. This is why we do Kahoot. You can't go back. Which patient should the nurse see first? The patient with the temperature of 95.5, the patient with a temperature of 101.3, the patient with a fever, or the patient with hyperthermia. Whew. I'm not playing with y'all today. Who should this nurse see first? Patient with the temp, 95.5. Patient with the temp, 101.3. Patient with a fever. Patient with hyperthermia. Somebody's going to catch this and say, Professor Regina, you not slick. I see what you did here. I see what you did. Maybe somebody will. But you're trying to play, right? So good. This is Kahoots.it. I love it. If you are playing, you are in it. I heard somebody say I'm in the hot seat right now. Correct answer. Nobody hardly got it. Come on, y'all. No. The patient with the lowest temperature. Everybody else had the same thing going on. 101.3 is the same thing as a fever. Is the same thing as hypothermia. What about your patient that's freezing? They cold. They ice cold. All the others were the same. The patient with the lowest temperature is most likely to die first. Watch it. All right, here we go. Double points here. We got to rebound from that. What was our patient's name last night for the 7 days of NCLEX? Was it red, Roger Hunt, yellow, Ronald Hum, blue, Robert Hughes, or green, Roland Howard? Did you show up to class yesterday? Did you show up to class? And do you remember your patient? Remember that sweet patient that you took care of last night? Don't be forgetting your patient because they be looking for you. They're going to come back, especially if you have somebody that comes into the hospital frequently. You better learn their name because they're going to learn your name. You want to have a good relationship. We just had the patient yesterday. Don't forget the man. All right. I love this 7 days of NCLEX. We're going to have fun every single night, right? Every single night we're going to come together and we are going to have fun. All right. Most people are taking off during holiday seasons. Not me. We turning it up. Hey. Correct answer. Yes, you remembered him. Brother Robert Hughes. And y'all know a little fun fact about Brother Robert Hughes when you see him. He was the first patient in 7 days of NCLEX. Who knows about Robert Hughes? Robert Hughes is actually very special to me because he's my what? Robert Hughes, that's my dad. That's my daddy. And so he helps me with Remar. He said he would play the patient. So shout out to him. Love you, Dad. Love you so much. Okay. So who won our podium winners? Clap it up. Third, GT, I see you. You snuck in there. Second place, Martin. Oh, in first place, give it up. Hey, Lexi, I love it. Hey, those were our winners. If you won, go ahead and take a screenshot of your podium and send it in to me, okay? Send it in to me and we will be able to award you your prize for being so super smart today. Let me go ahead and turn this off. We got to transition because we still got stuff to do. All right. So that was the first part of second shift of the 7 days of NCLEX. Now let's just do some housekeeping things. Right now, we are going to pick up our workbook, Okay. We're going to pick up our workbook and we are going to go into our lecture portion inside of the V2. How many people is 2 for 2 on the first shift? First shift, second shift, you attended. Yeah, that was a great game. We're going to do Kahoot again on the 7th shift, New Year's Day. Okay, New Year's Day. So what we're about to do is we're about to go into the V2, and I believe our lecture is substance abuse. So fingers crossed that we will be able to play substance abuse without any issues. And then I'm going to just ask some questions. What page is substance abuse on? Because I don't know. In our workbooks, it is page... Help me. I don't know. Yeah, substance abuse. You could do it in the V2 workbook or you could do it from this. Page 20. All right. So we're about to go in. I'm about to play substance abuse for you guys. All right. Let's go in to the V2 and let's find substance abuse. And remember, when you're studying for V2, you will have your workbook out and you will look and see. You can look and see how long each video is. So my videos are short and to the point. Medication administration, 14 minutes. Antibiotics, 18 minutes. IV therapy, 10 minutes. Substance abuse, 9 minutes. It's not substance abuse. What is it? It's supposed to be substance abuse for today. Let me fact check. I don't mind you guys fact checking me. Yeah, it's substance abuse today. Yesterday was diagnostic procedures. So today is substance abuse. Okay, don't be trying to fool me. All right. Is it chest tubes today? Wait a minute. Which one is it? Is it substance abuse or is it chest tubes? It's in the workbook. Oh, people are using, if you're using the old workbook, then it might be different. You need the 2024 version. Wait, hold on. I'm using the last year's workbook? Hold on one second. No, I'm not. Hold up. This is okay. All of this is okay. Oh, third shift is substance abuse. Oh, that's what he meant. Yes. No. You guys are right. I'm wrong. I'm wrong. Because substance abuse goes with our patient, Mark Grant. Chest tube. Somebody said you emailed this workbook. No, you're right. And I'll tell you because I did a little switch because I do mines before y'all get it. And so sometimes changes are made. Okay. All right. Thank y'all. That's why this is a community effort. We are doing chest tubes today, substance abuse tomorrow. Right? Some people are saying, no, it's substance abuse. Oh my goodness. Which one is it? I'm just going to play chest tubes. Right? All right. I'm just going to play chest tubes. I'm going to chest tubes because I believe the majority. I hear Mark say, play chest tubes. Okay. All right. So chest tubes. Chest tubes. Let's go to chest tubes. Chest tubes. Going into the respiratory sections, okay? And chest tubes, we about to play it right now. Load it up. You ready? Let's go. I love y'all. Welcome to your chest tubes overview. You know, chest tubes are seen no matter where you will work in nursing, from surgical to geriatrics to ICU. Let's talk about what a chest tube is. A chest tube is a one-way drain that allows fluid or air to escape the pleural space. Remember, normal breathing works on negative pressure. And negative pressure, if I try to explain it, it's the idea that when humans inhale, it's a result of the diaphragm contracting and moving down while the rib muscles move out. So all of these things cause the lungs to expand. The pressure inside the lungs drop, which allows the air to come in. And that's why we call it negative pressure. It's just the way the humans suck air in. Chest tubes are needed whenever the negative pressure in the pleural space is disrupted. Now, let's get into an emergency that would require a chest tube. What I want to look at is the tension pneumothorax. And you may have learned this in nursing school, but we're going to review it here. The tension pneumothorax is when air is in between the lung and chest wall. This may be caused by a trauma, a surgery, sometimes a fall. Anyways, what happens is there is outside air inside of the pleural space, and that air is coming in, but it's not able to get out. So for NCLEX, you do have to understand the tension pneumothorax, but also you have to be able to identify when a client is experiencing a tension pneumothorax. So let's go over this chart here. These are the classic signs of a tension pneumothorax. Trachea deviation. If you look at the x-ray on your page, you will see that this client has tracheal deviation. So write yes across from the box. It's a classic sign for you to know if a tension pneumothorax is present. Now, the blood pressure of this client, just looking at the x-ray, you tell me, would we expect the blood pressure to be up or down? We're going to expect this blood pressure to be down. The patient will be in shock. So because the blood pressure is down, what will the heart rate do? The heart rate will go up, yes, to compensate. Now, lung expansion, it will be unequal, but on the affected side, do you think the lung expansion is going to be up or down? It's going to be down. The lung expansion is absolutely going to be decreased. What about oxygenation for this patient? Will they have a healthy oxygenation? Will it be up or will it be down? It's going to be down. Yes, again. Now, the jugular veins, will they be distended or will they be decreased? What do you think? They're going to be up. Yes, they're going to be distended jugular veins with the tension pneumothorax. So, how do we treat this? How do we treat the tension pneumothorax? Because it is a medical emergency. The client needs treatment right away. The treatment of the tension pneumothorax is a needle decompression. Yes, a needle decompression into the second intercostal space. So now that you have that emergency out of the way, what typically happens is after the needle decompression, air will come out of the patient, maybe sometimes even fluid will come out of the patient after the needle decompression, but we cannot continue to do needle decompressions every several hours. We need something else to continue to draw the air and the fluid out of the client. And what that treatment is a chest tube. So you have to understand how the three chambers of the chest tube system work together. So we're going to move into our chest tube setup lecture right now. We're going to look at the three chambers. We have a collection chamber, a water seal chamber, and then the suction control chamber. Let's look at how to manage the collection chamber. The purpose of the collection chamber is to collect fluid, is to collect the fluid or the blood that comes out. Now, we want to notify the doctor if the drainage is two things, okay? First, we want to notify the doctor if the drainage is bright red, because bright red blood is new blood, is fresh blood. It indicates that the client is actively bleeding. We also want to notify the doctor if the blood or the drainage is greater than 100 milliliters per hour. What's the issue with a greater than 100 milliliters per hour blood or fluid return? it means that your patient, again, is bleeding out. So these are two things that nurses want to look out for. Now remember, the collection chamber is a way for us to monitor how much fluid is coming out of our client. So we never would want to empty it or dump it out. Let's move on to the next chamber, which is the water still chamber. The water still chamber is called the water still chamber because it actually has water in it that you will be able to visibly see, about 2 centimeters of water. Now, the purpose is to allow air to exit from the pleural space during exhalation and prevent air to enter the pleural space during inhalation. So the question always in the water, should you see bubbling? Should you not see bubbling? Some resources will call it tidling. Should you see tidling? Should you not see tidling? So continuous bubbling or tidling is a bad sign. It means that there is an air leak. You do not want to see that. What you want to see is intermittent tidling. That's a good sign. That means the water still chamber is working effectively. Now let's look at the suction control chamber. The suction chamber determines how much suction is being applied to your patient. Now it's the doctor or the healthcare provider that orders that. We as nurses, we cannot alter it. We cannot change it. But the suction control chamber also has water in it. So the question is, should there be bubbling or tidling? Should there not be bubbling or tidling? For the suction control chamber, it's just the opposite. Continuous bubbling is a great sign. It shows that the suction is on and it's working. Intermittent bubbling is a bad sign. It means that the suction is not working properly. So let's look at the care of a client with the chest tube. Number one, we need to assess the client for respiratory distress, breath sounds, and stable vital signs. The chest tube should be above or below the chest level. What do you think? The chest tube should be placed below the chest level. Yes. Number three, do not milk or strip a chest tube without a doctor's order. 4, daily chest x-rays are needed to check for fluid removal. 5, clients will have an occlusive dressing at the insertion site. 6, never clamp a chest tube without a doctor's order. Now, here are some common NCLEX troubleshooting scenarios that you will be placed in. Let's talk about what you are going to do. So, number one, if we notice that the water seal is broken, if we see that continuous bubbling, we're going to recreate a new water seal. The way we do that is we place, this is A, I want you to write this down, place the distal end of the tube in 2 centimeters of sterile water. That's it. And then the second scenario, if the client accidentally pulls his chest tube out, of course, we're going to stay calm as the nurse. We're going to A, use a gloved hand. B, cover the opening with an occlusive dressing. And then C, tape the dressing on 3 sides only, not 4, just 3, so that we can allow air to escape, and that will prevent a tension pneumothorax. Now, let me just go back and say something. When I'm saying an occlusive dressing, what's the difference between a regular sterile dressing and an occlusive dressing? What do you guys think? Well, the occlusive dressing blocks air from coming through the fibers. So an occlusive dressing will typically have petroleum jelly all over it. So when you open it up from the packaging, it will be all sticky because the dressing will actually be covered front and back with petroleum jelly. And that's what makes it occlusive. The third scenario that we have here is that the client complains of pain and they won't comply with any of the doctor's orders. If they're in pain and they won't walk, they won't do their incentive spirometry, what do? We medicate the client and then have them to cough and deep breathe. All right. So you medicate the client, and then you have to teach them to cough and deep breathe to prevent atelectasis. Now, in a perfect NCLEX world, you will have at the bedside of a client with a chest tube these three things always, always. Number one, you will have that occlusive dressing ready to go. 2, you will have sterile water. And 3, you will have a chest tube clamp. So let's do some more critical thinking to just test what we've learned. And I want you to attempt to do these questions by yourself and then come back with me to go over them. Number 1, what kind of lung sounds would the nurse expect to hear with a client who needs a chest tube? And this is a select all that apply. The options are number 1, wheezes, 2, crackles, 3, stridor, 4, diminished, or 5, pleural friction rub. The correct answers are number 2, crackles, which indicates an excessive amount of fluid with a chest tube would help. 4 is diminished, and diminished lung sounds usually indicate that air or fluid is in or around the lungs. So chest tubes would also help this condition. Now, the wheezing, the stridor, and the pleural friction rub are caused by things that a chest tube is not going to correct. So let's go on to the next question. When caring for a client with a chest tube, what should the nurse do to evaluate the effectiveness of the chest tube? Choices are number 1, empty the chest tube drainage every shift. 2, mark the chest tube drainage every shift. 3, clamp the chest tube when transferring the client. 4, add water to the water chamber when she notices it is low. The correct answer, mark that chest tube drainage after every shift. 3, what should be done once the fluid in the water seal chamber no longer fluctuates with inspiration or expiration? What's happening? Now, you don't see any movement in the water seal chamber. Normally, it's either continuously bubbling or intermittently bubbling, but now there is no movement. What we need to do is assess the client, assess the chest tube, but assess the client because possibly the chest tube can be removed. If there's no more air exchange, then maybe there's no more air in that pleural space. The chest tube can be removed. Number 4, after a client has his chest tube removed by the healthcare provider, which dressing should the nurse have ready to place over the incision site? So we're looking for a what here? An occlusive dressing, and it is going to be the Xeroform petroleum dressing should be at that insertion site. Before I close out this lecture, I want to just quickly look at ventilator alarms and the 2 that you need to know for your NCLEX exam. Now, there are 2 alarms that you need to know, and that is the high pressure alarm sound and the low pressure alarm sound when a client is on a ventilator. So let's start with the high pressure alarm sound. This goes off when there is a high amount of pressure required to get oxygen to your patient. So normally the ventilator has to put out more pressure if there is some sort of blockage. Maybe the patient has mucus that needs to be suctioned, or the patient is actually biting on the tubing. Those things will make the high pressure alarm sound. Now, the low pressure alarm will sound when the pressure is just too low and the air is flowing freely. This is usually caused by a disconnection or an air leak. So be mindful of these 2 types of alarms. Now, here is my REMAR tip about ventilator alarms. If you don't know what to do, then disconnect your patient and manually resuscitate them with an ambu bag. So if the alarm is going off, the nurse is unable to figure it out, you need to assume your patient is not breathing during this time. Just disconnect them from the ventilator and manually resuscitate them. All right. So now you guys are ready to cover these types of questions for your NCLEX exam. One more thing, a really awesome student has sent me this help that I want to share with you guys. It is the acronym HOLD, HOLD. And that stands for High Alarm Obstruction, Low Alarm Disconnection. I really love when you guys reach out to me in order to make this NCLEX review amazing. All right, you are ready to continue on to the next subject. Okay. All right, Remar nurses. So I was taking notes in the V2 workbook. If you have the V2 workbook, then parts of the segment will come straight from that book. So I wanted to make sure that you were actually taking the right notes. So I have some challenge questions about the lecture that you just saw, and I want to know if you know the right answer. So first question is this: is it okay to clamp a chest tube during patient transportation? Yes or no? Is it okay to clamp a chest tube during patient transportation? What do you say? Correct answer is no, 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 no. All right, good job there. What about this? Should the drainage system always be below the chest level? Yes or no? Should the drainage system always be below the chest level? What do you say? Correct answer. You said yes, that's correct. Okay, you're paying attention. What about this? Should a patient with a chest tube be instructed to take deep breaths and cough with a chest tube? Should a patient with a chest tube be instructed to take deep breaths and cough with the chest tube? Yes or no, or yes or no. This is your private tutoring. You want private tutoring? This is private tutoring. And it's basically just seeing whether or not you did the work you were supposed to do. That's it. It's accountability. Okay. The answer is yes. How do I say this? Okay. Should a nurse reinforce a chest tube dressing? Should a nurse reinforce a new chest tube dressing 8 hours after it was placed? So essentially, if a chest tube was placed in 8 hours, should the nurse reinforce the dressing? Yes or no? Correct answer is no. Nope. It's not part of routine care. You should not be reinforcing dressings just because, that's just not something you would do. Okay. Okay. If a patient with a new chest tube has crackles, is that considered a medical emergency? If a patient with a new chest tube has crackles, is that considered a medical emergency? What do you say? Correct answer is no, because crackles indicate what? Fluid. And so the chest tube being new, you have not allowed possibly that treatment to happen. Okay. So that's why it's not considered a medical emergency if the patient has this intervention in place, especially if it's a new chest tube. Okay. Question. If a patient with a chest tube has sharp chest pain, should the nurse expect a pneumothorax or an infection first? Okay. If a patient with a chest tube has sharp chest pain, should the nurse expect a pneumothorax or an infection first? Which one? Good. All right. I said a pneumothorax or an infection first. Which one? Okay. Correct answer is going to be pneumothorax. So you got that one right, pneumothorax. Okay, everybody, this was taking a segment out of the full V2 program and allowing you to go through it so you can see the actual difference of studying lecture content as opposed to just doing practice questions. And I think for somebody, it will be the difference in you being able to actually make progress that is trackable, right, in the V2 system. So during the 7 days of NCLEX is our next promotion. PAL, if you don't have the V2 program, you can get the entire program, books, question bank, computer adaptive test, the whole kit and caboodle, plus bonus first shift book. I will be sending that to you. 1 month access is $69, but if you want to give yourself more time, 3 months access is $99. Now, before we go, I do want us to meet our patient for tomorrow because the third shift of the 7 days of NCLEX is happening. And your patient's name, if we look in our workbook, it is going to be, what's the patient's name? His name is Mark.
Oh, Mr. Grant, we get to put you in isolation, whatever that means.
Okay. You know what? Let me check on that. I have some other things I need to check on too. So thank you so much for telling me. How do you feel now? Any pain? Any nausea?
No, I'm fine. But I do want to tell you this. Keep that crazy nurse, Henrietta, away from me. Please.
Got it. Thank you so much, Mr. Grant. We'll be back, all right?
Okay.
All right.
So I'm so excited about tomorrow's patient. Every patient that is coming to the 7 days of NCLEX is here to teach us a lesson. And so we have tomorrow night. It's a prime time show, means we will be doing it in the evening. Put the time in the comment box if you know what time we are coming back for the 7 days of NCLEX. We're coming back for the 7 days of NCLEX. And absolutely, we will be here waiting for you to show up to get the education. Yes, our patient so upset with Nurse Henrietta. Nurse Henrietta is making friends and making frenemies at the same time. Tomorrow at 8 p.m., we will be back for night number 3, the third shift of the 7 days of NCLEX. And I'm just really having the best time with you all. And I know that this will be more of a community builder for us later on. So second shift has been served. I will see you all tomorrow night, 8 p.m. Eastern Standard Time. Convert it to your time zone so that you will be here as well. You don't want to miss it. This is the largest NCLEX prep right now happening in the world, and you make it so special by attending. So second shift has been served. See you later. Bye-bye.